My name's Graham Bauer. I'm 42. My partner is Martin, and we've been together for 12 years. I was diagnosed with a cutaneous T-cell lymphoma with mycosis fungoides, which is a kind of skin cancer. It's a non-Hodgkin's lymphoma. Martin and I had always been very close. We've always been like best friends. So I guess when I was diagnosed with cancer, then that had a huge impact on both of us. When I was on chemotherapy, I was quite unwell for a lot of the time. I had allergic reactions to some of my medication, and I had some serious infections. And so feeling unwell like that, I think it's natural that you're not so interested in sex. And I wasn't. And to be honest, Martin and I didn't really even think about that much. It's not the first thing that's on your mind necessarily when you're going through that kind of experience. And whilst I think it's important, our relationship is about so much more than that. The problems with my skin had an impact on my confidence. Friends would say things like, it looked like I had alien skin, and I knew that they were joking, but those things, they sort of affect you inside, affect your confidence. Before cancer, I was very unfit, unhealthy, overweight, and to just have skin that was perpetually flaking everywhere really did not make me feel very confident about my appearance at all. The problems with my skin didn't affect my relationship in the sense that he never made me feel bad about them at all, never. They didn't seem to bother him as much as they bothered me. I do think one thing that everyone needs to consider when they're going through chemotherapy is fertility and sperm banks. Even if you're not at a stage in your life when you're necessarily thinking about having a family, it might be that that's the time in which you need to make a decision. And I think a lot of people might assume that it's less important to gay people. But it obviously is just as important to anyone that wants to have a family. So I think most hospitals will talk to patients about this. But I guess I would encourage any gay friends that were about to go through chemotherapy to think about that. A lot of things changed as a result of the cancer. But I think one of the most important ones is that I really feel it brought us together in a different way, that the friendship became even closer.